I expected there to be pain after ACL surgery, but I didn't expect there to be so much pain in the harvest site where you actually took the new graft from one of your tendons. Right now, the quad tendon has been my biggest struggle for the last few weeks during my rehab. In this video, I want to cover what it feels like, why it's happening, and things that have helped me so far over the last couple weeks. I'm about 16 weeks post ACL reconstruction and meniscus repair. And right now the quad tendon pain shows up pretty much anytime I use my quad. So like squatting, leg extensions, using stairs, anything really. And when it flares up, it feels like a sharp pain just above your knee and just below your quad for the quad graft. And naively, I didn't realize this was gonna be such a struggle, I guess, with the rehab. I thought once I got in the gym, everything would be easy. Just from there, it's just about strengthening the leg and getting back to normal. But right now, I'm really navigating, the quad tendon pain and really trying to mitigate any issues with that while I'm going through my rehab journey right now. So there are three main grafts used for ACL reconstruction, autografts that is, and that is the bone patellar bone, the quad graft, and also the hamstring graft. So I myself had the quad graft, so that's what I'm gonna be covering in this video, obviously, as you can tell by the thumbnail and this intro so far. But yeah, so the quad graft is taken from your quadriceps tendon, which is just above your kneecap, just below the quad. And it leaves a small gap that your body has to fill in with scar tissue. And early on, the tendon can be pretty weak, sore, sensitive, all the above. And so while the new ACL graft is healing inside your knee, there's also the harvest site that's healing. So that's another part of the recovery process. Some people have a harder time with their tendons adapting after surgery. I know I myself have had quite a bit of struggles in the last couple of weeks with that. I know other people who had no issues at all. So it's really kind of variable and it kind of changes from person to person. But I myself am going through a lot of struggles right now with the quad tendon pain, and it's pretty much like touch and go, trying to figure out how much I can do without irritating it to the point where I have to take several days off of rehab and just trying to keep it slow and steady basically, so that I'm not doing a lot then having to take 4 days off before I can do anything again. So right now it's been a struggle for me myself. I found that doing quad isometrics has been one of the most helpful things for me right now in my journey navigating this quad tendon pain. So it's just basically sitting in a chair and you're in a 90-degree position with your knee and you try to push out, kind of do like a leg extension, but you're restricted and you're just kind of really isolating that quad tendon area, and getting that blood flow going in there really helps the quad tendon pain. That's been really helpful for me. So I usually do that as a warm up, as I said, and if I do any exercises after that warm up that kind of irritate it, I can kind of trick it back into feeling good for a little while by doing that quad iso again. So it's been really helpful. So at PT, we'll try some things out. If it doesn't really work too well and it starts to irritate the quad tendon quite a bit, then we can go back to the quad isos, get it feeling good again, and then do some exercises that we know help my quad feel better and get stronger without irritating that quad tendon. And right now, once I'm done with my gym routines, I kind of have to take like at least 2 days off before I really do much. So that next day, I'm maybe doing like light biking just to kind of move the leg a little bit, maybe light stretching. If I do anything intense, like if I do deep stretching the day after, it feels like that quad tendon's like almost tearing apart and does not feel too great. I know it's probably not really tearing. I don't really know exactly what's going on, but it does not feel great, let me tell you. And I really thought once I started going to the gym, I was just gonna be up from there for my rehab, just work out as much as I can, get my legs stronger. And I just naively thought it's gonna be so easy from there, but little did I know that this quad tendon pain issue was something that would really kind of restrict my progression and improvements week to week. It's been about a couple weeks since I started going to the gym, and since then, my quad tendon has had a hard time adapting, and it's been really irritated, and it's been a lot of, doing a little bit, resting, and it's just not as steady of progress as I thought it would be, I guess. And if you're going through something like this in your rehab journey, I think it's probably the best thing to do is just be patient, which is very, very hard. I know it sounds easier than it is. I myself am not a patient person, especially when it comes to this kind of rehab, but just, being patient, not focusing on what other people are doing and how the rehabs are going. Don't compare yourself, and really focus on things that kind of help relieve the tendon pain. So for me, the quad isos really help. Icing has been helpful after, gym days or something where I'm really loading up the tendon and kind of irritating it. Massaging has been a nice one too. Really massaging, getting any kinks out of it, any knots in that tendon area, also in your quad. If you relieve any of the tendons in there, or sorry, any of the bumps in there, I found that to help the tendon pain as well. So kind of really just relieve all that in there, and just try to progress your rehab in a smart manner. Don't, go all out thinking like I did. You can just jump straight to like, the hardest difficulty, load up your quads a lot in the gym. Kind of stay steady and smart, and don't, make a nice steady trajectory. Don't want to go up and down, load up a lot, then take several days off because you can't do anything, then back up. So just try to keep it steady instead of going up and down. It'll just be, I think, mentally a lot easier. Doing this roller coaster thing has been a little difficult the last couple of weeks, so it's something that I'm learning to deal with myself and try to be on a nice steady trajectory. So yeah, just try to be smart about that kind of thing. And like I said, don't compare your journey to anyone else's. Your journey is completely different from someone else's journey. They might have had a different graft, they might have had the same graft, whatever it is, everyone else's journey is completely different. Little nuances can change everything. So just don't focus on other people, focus on yourself and what you can do, and just be smart about things. Don't go too crazy, but be aware of the struggles that might come up and try to navigate those as best as you can. If you found this helpful, or if you're going through something similar on your journey through ACL rehab, consider liking this video, subscribing. I'm documenting my journey through this rehab. I'm only about 4 months post-surgery, like I said at the beginning of the video, but I'll be documenting well into the future, hopefully, and just hopefully help people out there who are going something similar, and maybe show some tips and what might come up later on. So yeah, thank you for watching.